So welcome to part two of our training on navigating public benefits for immigrants in Illinois. My name is Kristen Hartsaw, and I'm the Director of Training and Technical Assistance at the DuPage Federation. And today we're going to focus primarily on the SNAP program, but also touch on a few other food programs. Primarily, we'll talk briefly about WIC, but then I also want to give you an update on the P-EBT program for this school year. And then we'll also talk about the cash assistance programs, both those through the state of Illinois and also the Social Security cash programs. And throughout today, what I'm hoping to do is give you the highlights of each program, but really call out a few of the rules that immigrants need to be aware of or think about, or maybe you as providers that assist immigrants, so that you have a general awareness around that. Again, just some housekeeping rules. I think, we've all been dealing with Zoom or other meeting platforms for almost a year, but please do keep your lines on mute just to minimize that background noise. I asked if you can to provide your introductions in the chat box, and certainly enter questions into the chat box as well. I will pause throughout the presentation to try to take a look at those questions and answer. So let's get started. And I should mention, the recording will be made available after the presentation, as well as this handout and some additional handouts as well. So I will send that out if it doesn't happen today, most likely tomorrow morning. But for those of you who were with me last week, we spent a lot of time talking about immigrant eligibility for public benefits in general. So I just wanted to review that one more time. And remember, there are always exceptions, right? If anything, I think we've learned that immigration law and eligibility for public benefits is made up of a series of exceptions. And if you've been following the news, you may have heard that President Biden is proposing some comprehensive legislation to address immigration. And I'm excited because we need something comprehensive. But then I read another article that, all of this will involve negotiations and compromise. And so maybe they'll do things piecemeal. And I really wish that wouldn't happen, because I think that's how we got here in the first place. We have all these different exceptions and piecemeal, and by piecemeal, I mean one piece of legislation, not a huge comprehensive. So anyway, we will see what comes of that. Anyway, so back to qualified non-citizen, right? What is a qualified immigrant? In general, to access benefits, they have to be a lawful permanent resident for at least 5 years or longer, right? So we remember that, and we know that a lot of immigrants are familiar with this 5-year bar or waiting period. But also remember, there are many humanitarian statuses or special immigration statuses that do allow an immigrant to access public benefits without that 5-year wait. And we'll talk about that in particular with the SNAP program in a few moments. So that's just our review. That's just setting our context for overall eligibility. So the food programs that we'll touch on today, primarily focusing on SNAP. So we'll have a lot of detail about the SNAP program today, but I do want to mention a little bit about WIC and then some other food resources like the school nutrition programs, as well as senior food programs or food pantries. Food security and hunger has kind of become a passion of mine ever since I've been doing this work. It's pretty amazing to me that we live in a country and even in a world where people are going hungry, knowing how much food really is out there. And so I'm always excited to share this information with partners, and especially to get the word out to different communities, because I think sometimes people are not always aware that they may be eligible for these programs. So SNAP, the Supplemental Nutrition Assistance Program, it's administered at the federal level by the U.S. Department of Agriculture. Fun fact, it's actually part of the Farm Bill. So I grew up in a farming family. And so growing up, I was familiar with some of the different subsidies and and that farmers might receive and some of the regulations that go along with that. And I never realized that the food stamp program was a part of the Farm Bill. And I only mention that because every time the Farm Bill is up for authorization, that is when you'll start hearing about the SNAP program. And sometimes there's members of Congress that want to remove SNAP from the Farm Bill, because the farmers have a huge lobbying industry to kind of push their incentives and their programs forward, and they don't want it to get slowed down by the SNAP program because unfortunately there is a stigma around SNAP. And it's just a shame, I don't sometimes understand why that is. I see a lot of working families who are eligible for SNAP. So whatever we can do to bust some myths, right? That's what we do. SNAP can only be used to buy food products, so it is pretty strict around that. You can't use SNAP to buy diapers, can't use it to buy alcohol or tobacco or anything like that. It really is meant for food products. It does allow purchase of seeds or plants to grow. So, as spring starts coming around, people on SNAP can use it to buy those products and grow their own food. And there are some farmers markets that do accept the link card as well, or accept SNAP benefits so that people can get access to healthy and nutritious food. In Illinois, you have to be an Illinois resident to get SNAP, right? So live in Illinois, be a citizen or a qualified immigrant, and meet the income limits. And I'll spend some time talking about income and how the state calculates benefits. But remember, as we talked about last week, for those of you who were here, mixed status families can apply for SNAP for any family member that has an eligible status. And so I'll give you an example of a mixed status family in a little bit. So this slide talks about the exceptions to that 5-year waiting period to access SNAP. There are some immigrants who are able to access SNAP even if they haven't met that 5-year wait. So in this case, I'm talking separate from those kind of special humanitarian status. This isn't refugees. These are other non-citizens. And so really the takeaway is if you are working with a family who maybe doesn't meet the regular immigrant eligibility for SNAP, think about whether or not they are a child under 18, or if they are someone who's disabled, or if they are a military veteran or active duty, or if they already have 40 work credits. And we might not know that, right? That might be hard for us to know if an immigrant has their qualifying work credits. But if they do, and their INS status meets any of the following listed here, like lawful permanent resident, that means a child under 18 who's a lawful permanent resident could access SNAP before the 5-year wait is up. His parents might not be able to, but as a child and they meet these conditions, they would be able to. And then there's some other references too. So the conditional entrant and parolee status, I will be honest, that kind of crosses over into immigration process and kind of outside of my scope of what that actually is. I lifted this right from Department of Human Services policy. So for some of you who might be DOJ accredited reps or be more familiar with these specific sections of the Immigration and Nationality Act, you might have a better explanation for those. But I want people to be aware that there are some exceptions to the 5-year rule for certain populations. And so those probably top 3, right? Child, disabled individuals, or veterans, military members. Then you might want to explore a little bit further what their immigration status is, and maybe they can apply before their 5 years is up. So when it comes to SNAP, what's considered a SNAP household, right? We get this question all of the time, we being myself and other advocates and trainers. And the overall answer is the state's really looking at who's living together and eating together, meaning who's sharing their food supply within the home. And that's kind of regardless of relationship. So that's that first circle here on the slide. So if you have two families who are doubled up living in the same household and they have decided to pool their resources, and maybe there's one person who is staying home and is doing all the cooking, but everyone eats together and shares their meals together and their food supply, technically those two families should be one SNAP unit. Now, it's not like the state's going to send out a worker to verify, right, in the home or do a home visit or anything like that. But how it might come up is if one family already is on SNAP and then that other family who's sharing the residence then applies. When the state does the processing of the application, they might notice that there's already an active SNAP case at that address. And then they may ask at interview, what's the relationship to the other people in the home? Again, if they're sharing their meals, technically that's what policy says. But if they keep their meals separate and they don't have any relationships as defined in the next three circles on the slide, then they would be separate units. So then there's some people who must apply, even if they don't eat together. So spouses who live together must apply together. And we are seeing more and more cases. I actually have a friend in this very situation. She is in the process of filing for divorce, but the husband still lives in the home. And so they've gone through and they've started the process. But they still live together. And there's no like paperwork saying legally separated or anything like that. If she needs to apply for SNAP because he's still in the home, she would still need to include him, even though they're not eating together and they're basically living separate lives. We see this a lot more these days. The other thing that's really interesting about the way the policy is phrased, and this may impact some immigrant families, like from a cultural perspective, is that even if they might not be legally married in the United States, but they are committed to each other and they are putting themselves out to the community as spouses. They technically, that's the way the policy reads. So again, I don't know how DHS would necessarily prove that per se, but really then we would pull back to the overall issue of, well, are they living and eating together, So, and if yes, they still need to apply together. Parents and children, you are considered a child for the SNAP program until you turn 22. So I have an example and I'll show that example in a moment. And then also children who are under 18 who are under the parental control of someone in the house. This is referring to children who are maybe not the adult's child. So if I take in my niece or if I take in my best friend's daughter because they're not getting along, and that child is technically living with me, they're technically under my parental control. And so if the child needs food assistance, they would need to include me on the application. Let's look at a couple of examples. So Sylvia is a great example of that age issue with the SNAP policy. So Sylvia's 20, she's pregnant, she has one daughter, she recently left her spouse, she moved back in with her parents. Sylvia has her green card and she's had it for almost 6 years now, right? Depending on when in 2015 she got her green card. If Sylvia applies for SNAP today, the fact that she's living with her parents, even if her parents say, you can live here, you can have a room, we don't want you living, we don't want you homeless, so you can stay here, but you have to pay your own way, Sylvia might need assistance. And so if she applies for SNAP, because she is living with her parents and because she is under age 22, her parents' income needs to be included on the application for Sylvia and her daughter. Even if her parents don't want the SNAP, their income will be used for Sylvia's eligibility. There are ways to say that it's a separate living unit if she is, let's say, truly in a separate unit. So if her parents have a home and they have a basement apartment with a completely separate entrance and separate kitchenette, or even like, a 2-flat, 3-flat, it's truly separate living quarters, then she might be able to be set up as a separate case. But if that's not the case, then her parents' information needs to be included. And here's a mixed status family example. I'd mentioned that a little bit ago. So in this case, we have Lee, who is a citizen and married to Ava, who is an LPR. They have 3 children. All the children are US citizens. And so we know that Ava, as an adult, being an LPR for less than 5 years, she is not eligible for SNAP. But if the family meets the income requirements and is in need of this assistance, they can apply. And essentially, what happens is that the state will look at this family as a household of 5 to determine the eligibility for the SNAP program for 4 of the members. So that's a really simple way of explaining it. They actually prorate like household expenses and income among the 5 and determine that. But yeah, basically the takeaway is Ava's information must be included to determine her family's eligibility for SNAP. These are the current income limits for the SNAP program that went into effect in October of 2020. SNAP and TANF benefit amounts and deductions and all of that usually update in October, whereas the Medicaid income limits, which we'll talk about next week, usually update January 1st, though the state is always very slow to publish the policy around Medicaid. Anyway, so these are your current monthly income limits. State always looks at gross monthly income. You see 3 columns here. So you have non-QM and QM. The difference really is that in a QM household, that is considered qualifying member. It just means that someone in the SNAP unit is either disabled or age 60 and older. So you're considered a senior citizen or an elderly person at age 60 for the SNAP program, even though 60 doesn't seem right that elderly anymore. I will say there's a lot of benefit to this. They have a higher income standard and there's some additional deductions. So if you do have someone in the home who meets that status, right, of disabled, blind, or over age 60, it's important to indicate that on the application because there are some additional protections. And then non-QM households, that means no one is over age 60 and no one is disabled. I've also listed the net income standards because really the net income standards historically that determines how much benefit a person will be eligible for SNAP. And I'll talk about that in a little bit more detail in a couple of slides. A few things, I'm not going to dwell on this, always submit proof of income with applications. It's really the hardest thing for the state to verify electronically sometimes. Again, they're looking at gross income. If someone is paid cash or is considered self-employed and they have expenses as a self-employed person, be sure to include expenses too. If they're paid cash, they need a way to kind of document what they're earning. So whether that's their own records or ledger, if they can get a statement from an employer, if they're working for like one person, things like that will help. Technically, the state should accept the client's statement. So if they attest and can show their records of, how often they're paid, that goes a long way. And the state has very detailed policies. Like migrant workers, there's some really specific policies for them, like designating a home county and some different things. But they have very detailed policies, whether it's earned income or unearned income. And so if you are interested in something specific, I'd be happy to point you to those chapters of the policy manual. So how do they determine the budgeting for a SNAP unit, and how do they apply deductions, right? And I'm going to actually show you a screenshot of deductions in just a moment. But essentially, there's this gross monthly income test. And if they meet the gross income test, then they're going to try to figure out what the net income is so that then they can determine how much SNAP to give the household. And so there's some various deductions, and we'll talk about that in a greater detail when I show you the screenshot. But I also want to mention quickly, again, those special rules for those qualifying member households. And QM households, they can get some additional deductions if they have regular medical expenses. Also some additional shelter deductions, and if they're paying for dependent care, they can actually deduct that as well. And so this is a screenshot. It's like the bottom left corner of the state program standards. So this is available on the Department of Human Services website. It's known as the WAG 2532. I have that at the top. WAG stands for Workers Action Guide. And so this is kind of the policy, the procedures for the state caseworkers. And so this, I took the screenshot of it just yesterday. So this is what's currently posted. So you see, when someone applies for SNAP, if they have 1 to 3 people in their home, the standard deduction is $160. So they'll subtract that off the family's income. If it's 5 or more people, you can see it's $205. Those of you who help with applications, you've noticed when they ask you what utilities they pay, right? They don't ask necessarily on the application how much they pay. They ask what kind of utilities. And so depending what utilities the family pays, that will determine then the utility deduction. So you can see if they pay AC heat, it's $496, and there's some others. The medical deduction you can see, so if they have those medical expenses of over $35 a month, they'll have an additional $200 taken off their income if they are a QM household. And same thing, those QM households, shelter deduction, the max is the $586. And then you can see some other deductions as well. So they will do dependent care deductions, not just for elderly, but also for children. And so you can see the difference here. So I hope that's helpful. You know, that's one thing. It happens on the state's side of the work. You know, we submit the ABE application, and then the state worker has a form within their computer system to budget all of this. And it's based on how we mark the ABE application. So this is in normal times, if there's ever going to be normal times again. This is the maximum families can receive based on their household size. So you can see the max in SNAP that a single person can receive is $204 a month. A family of 4, the maximum they can receive is $680. And in normal times, usually what happens is it's the net income that drives how much SNAP they receive. And so there have been times where you might be working with a person, especially we see this sometimes with seniors who have fixed income of Social Security retirement checks that result in a pretty high net income. And they actually sometimes only get $16 a month. And yes, that can be an accurate decision by the state. It really depends on what is that net income. However, due to the COVID-19 public health emergency, the state has been issuing emergency allotments. And so they've been bringing households in that situation. So if it was that one person receiving only $16 a month, they should have been bumped up to the full benefit amount for the past several months. I can point you to the specific state policies about emergency allotments if you need it. I also just want to mention that through June 21, one of the, it happened right in December, right? I think is when, it doesn't matter when it happened. Anyway, there are some new protections, and there is a temporary increase of benefits through June 21. And so I have given you the policy reference for that. Part of what we were seeing is that households who were already at the max, you know, they weren't eligible for an increase in benefits like some of the others. And just anyway, just recognizing that the strain that the public health emergency, the COVID-19 epidemic, pandemic is causing on families is why we have this increase. Overall SNAP application process, as I talked last week, really important. Submit those applications online. It's just the best way to track And so you can also apply for SNAP on the phone, but there's some wait times. After applying, there'll be an eligibility interview. Regular SNAP applications need to be decided on within 30 days. And if approved, they'll get the link card in the mail. Now, there is something known as expedited SNAP, or sometimes people call it emergency SNAP. And this is when the applicant has very low income and really next to none in terms of assets. So they really are very limited resource. That's kind of on the bottom part of this slide. And every application that gets submitted through ABE gets screened for eligibility to see if they are able to get expedited SNAP. And so it's a different timeliness expectation that the state has. And so the interview basically needs to be done right away, and they may need to make a decision and process this case within 3 days if they might be eligible for this expedited service. So let's talk about what happens after application, right? So after application, the office is going to try to contact them. Many offices were doing cold calls. So they, especially for the expedited SNAP, they were calling the customers right away, within a day at the latest, because the state had been working on getting their timeliness in processing up. The federal government was requiring that of the state prior to the COVID-19 pandemic. And I believe they are still meeting their timeliness. What that means for the immigrant population, especially if they don't speak English very well, is they need to be prepared to receive this call. Now, on the application, you have the option to mark, if the person needs an interpreter. It's not phrased that way. You select what language they speak. I would put it in the comment section, the ABE comment section as well, especially if the person needs an interpreter, so that when the state worker calls, they hopefully would have, that telephonic interpreter resource available. But I don't know how seamless or how smooth that process actually goes. So you need to just prepare the applicant to know that they're going to receive this call. The other thing we can do is to let them know what number it might come from, although right now I have no idea how the state workers are making calls if they're working remotely. I'm just not sure what's showing up on caller IDs. It's been a while since I've helped families, so you might actually have a better feel for that than I do. But regardless, if they don't answer the call, the cold call, and what I mean by cold call is that nothing has been scheduled yet. The state worker just tries to reach the person on the phone. If that is missed, then what they'll do is they will send a notice with an appointment for a SNAP interview. And those of you who have worked in this area for a long time know that sometimes those calls come right on time. And other times they might be scheduled for 11 a.m. and the call doesn't come until 3 p.m. Sometimes, if the person's phone number has changed, that could be an issue. The state worker is going to attempt to call the number on the application. So I think just helping families understand what to expect after they submit the application is helpful in making this happen. Once the interview is done, that's where they kind of verify everything that was on the application. If they have questions about anything that was submitted, that's what they will ask about. If additional proofs are needed, they'll let the person know. And then they have to make a decision on the case, like I said, within 30 days. And then that decision is sent in writing. I will say during this public health emergency, the state is waiving interviews in some cases. So if you can submit all the proofs at time of application, so proof of income, proof of immigration status if it's needed, proof of, I'm trying to think what else would be important with SNAP, all of it, but really proof of income is sometimes the hardest, like I said, for them to check. If they can verify everything with the proofs, they have been waiving interviews in some cases because they're just trying to process the applications and get people the benefits that they need. If approved, they're going to receive the link card in the mail. And so these are just a couple of talking points about the link card. That's what's used when they check out at a grocery store that accepts the link card. I didn't mention it, but whether or not a grocery store accepts SNAP is really between that retailer and the USDA. So they have to meet certain requirements to accept SNAP or the link card. And we do have some retailers now that people can purchase online using their link card. So Walmart and Amazon, and I believe Aldi has also come on board in Illinois. And my understanding is other retailers are trying to do this as well. So that's helpful for those people who want to order delivery from the grocery store rather than have to go to the store. To activate the card, they need to call the link card number. There's a PIN number. It's really like a debit card, so they need to protect that. Only one link card is issued per household. So, if you have two families doubled up on the same SNAP unit or whatever the case may be, if you have a very large family, there's only going to be one link card issued. Let's see what else. Oh, when set up for SNAP, many households are set up on a 12-month kind of recertification or redetermination for short. And what usually happens is at the midpoint, 6-month mark, they need to report back whether or not any changes have happened. So they will actually receive notices in the mail, and it's a fairly quick turnaround time. And so they need to return that form even if they've had no changes at all. If they don't, their benefits will end. So this is just kind of outlining when to expect the form. Now, there's been some confusion around this, and with all of the different waivers that were enacted due to the COVID public health emergency. So, like I said, usually recertification happens at least once a year. But what happened because of the emergency is that the state was able to get some waivers from the USDA, and so they were able to extend the certification periods for households. So I think it even started last March. I don't know, it's all a blur. That was a year ago. I can't believe it. So I believe it started in March, but what happened was, and certainly with April forward, this has been the case where if you were due for your 12-month recertification in April of 2020, your benefits were extended for 6 months. And they did that every month. Again, trying to keep people healthy and fed and keeping them having access to their food benefits. Now, for those cases that, got extended in April for 6 months, they were then due to recertify in the fall. And now what I can tell you is that they will not be extending cases for 6 months after this month. So starting in March, next month, anyone due to recertify in March will have to recertify. They're not going to extend cases anymore. I mean, part of this is they need to just verify what income is and where people are at. They're also trying to phase in how many recertifications now that they have to do, because by postponing and extending, there's just kind of a backlog has been created. I will say, before January, it was each month the state had to work with USDA on requesting these waivers. And so there were some households, it was just confusing. Some households got these notices and didn't really have to recertify, and then others did. And so anytime a notice comes from the state, the best thing to do is just make sure the family responds right away and follows the instructions in that notice. Excuse me, this chart is just showing kind of where people are. So if they are currently in an extension period, they will continue that extension. Excuse me. Just swallowed wrong. Okay. So you can see if someone's currently in a recertification process, they were extended like the December 2020 folks who were due for recertification, you can see they were extended until June 2021. And at that time, they will have to recertify. But the last month that anyone will be extended, 6 months, are those households who were due to recertify here in February. Excuse me. All right, let me pause here. I'm going to go back again and just check and see if you have any questions, because I know I just ran through a lot of information about the SNAP program. So let's just see real quick. And I see so many familiar names. It's great to see some of you virtually here. All right, so Oksana asks, so families will be getting full SNAP benefit amount till June due to COVID-19 waiver. She had a family recently approved for only 64 months, or excuse me, $64 a month for the household of 3. So I can double check the policy. I thought they were still doing emergency allotments, but you know, so many policies have been coming out. So I will double check that. And if there's even time at the end of the presentation, I can try to get online and we can look at, I can show you where all these policies are housed. And then Wonder said, great, thank you for sharing that some of the workers have been assigned cell phones that they use to call clients. I would hope that would be the case, right? I just wasn't sure what resources the state had. It is certainly a struggle to get a hold of a caseworker, Zulma. It is absolutely challenging. I will say you can go to the DHS website, and if you go to the contact section and then go and look and find, try to find the local office, on that page, they actually have a link to urgent call teams for all the local offices. It's incredibly challenging to get a hold of a caseworker because they are working remotely, very limited staff in the office. And so my understanding is that when we leave a voicemail, that they actually are assigning those voicemails out via email for the state workers to respond to. So if it continues to be a challenge to get a hold of someone, we can try to give some suggestions. Yes, I will send the PowerPoint. It's also linked in the chat. And then Rocio is asking about medical recertifications. There is no word yet when medical reads will determine. Those are kind of being held until the end. The emergency is officially declared over, and they will be working with Health and Human Services about, or CMS, Centers for Medicaid and Medicare, about how to bring that on. And so when I was on the Medicaid Advisory Committee call the other week, they stated that they are supposed to receive 60 days notice in advance from the federal government of when they will have to do that. So yeah, SNAP recertification is completely different from Medicaid right now. And yes, the asset limits for SNAP, you know, thank you, Oksana, for asking. I don't usually talk about assets with SNAP anymore, and I really should. So asset limits only apply to QM households who are over the gross monthly income. So I would have to double check. I don't think there was any significant change, but we can certainly pull up that WAG document as well. But yeah, assets don't count for the non-QM households. It's just not a factor. They either meet the gross income test or not for the SNAP program. All righty. So let's talk about some other food programs real quick. It's just briefly. So we're going to talk about WIC and the school nutrition programs. And then really, I just have 1 or 2 slides about the senior food programs and food pantries. But I just want to make sure we know what are the other options that we can refer families to. So WIC stands for Women, Infant, Children, right? This is a food supplement program for a very specific population. It is for pregnant, postpartum, or breastfeeding women and children up through age 5, so our young children. It's really all about getting, having a healthy pregnancy, having access to that nutritious food, and also a healthy start to the child's life. So what is required? So income, you have to be an Illinois resident. Your income has to be at or below 185% of the federal poverty level. And so I've given you the single person and family of 4. salary range on an annual basis. You can find the listings on the USDA website. And this goes on like almost like the state fiscal year, right? It's July to June that we see these income limits in place. Technically, they have to be deemed at nutritional risk. And so there's like a kind of a nutritional assessment. This is just where they meet with a dietitian or a nutrition specialist or a nurse to determine that. So you see a lot of prenatal programs at the community agencies who have these programs set up. It is important to know that WIC does not have an immigration status requirement. WIC is not subject to public charge, right? This is not one of those benefits that is assessed for public charge. So women and children, regardless of immigration status, may access this program. And how is WIC different from the SNAP program? Well, it's really focused on that nutrition piece. And so it's really nutrient-rich foods. When you go grocery shopping, you've probably seen the little tag on the shelves, you know, WIC approved for things like beans or certain dairy, depending on the grocery store. And so that's how it's different. Also, historically, it was different because it's been delivered on actual food coupons. But starting, I think it was in September in Cook County, WIC is starting to be delivered on an EBT card. So I'll admit I haven't followed that as closely as I should have. I don't know when it's rolling out to other parts of the state, but the Greater Chicago Food Depository does have some information about that rollout on their website if you are interested. So remember Sylvia applied for SNAP but was denied because her parents' income counted, right? Well, she's over age 18, so for the WIC program, they're not going to look at her parents' income. They're going to look at her income only. And since she is pregnant and her daughter is under age 5, excuse me, they can both get WIC. She can get it for the duration of her pregnancy and while she's breastfeeding, and then her infant, once born, can also receive WIC. And they allocate out like a certain amount, and I actually don't know the ins and outs of it all in terms of, you know, like you get a half gallon of milk or whether you get certain like formula for infants. They can't be breastfeeding, I don't think, and get formula, but someone else may better know that answer. But when in doubt, refer to the community agency for this program. And then here's another example. So we have Mildred. She's a permanent resident, so she has her green card, but she's only been here for 3 years. So she's not eligible for SNAP, right? She, as the adult, doesn't have an qualifying immigration status, but she has a 2-year-old daughter and she's also pregnant. And so again, she can't get SNAP for herself, though her daughter could, since her daughter is a citizen. But Mildred could get WIC while she's pregnant and also get WIC for her daughter because the daughter is 2 years old. So this can be a huge support to families. So you apply for WIC not with Department of Human Services, you apply with the community agency. And outside of Chicago and Cook County, it's often with your local health department, though there are a couple of counties that might have a community health center that is a WIC agency. And in the city, it certainly is a number of different community-based agencies. And you can find the WIC organizations or the agencies that process WIC applications on the DHS website. I will say we did have especially when public charge rolled out, there was so much confusion, and we did have a lot of families who were trying to cancel their WIC because they were so concerned about it being subject to public charge. And I just want to remind us again that it is not subject to public charge. It's not one of the benefits listed in the final rule. So they should not be fearful of using this program. And there is a fact sheet specific to WIC and public charge to kind of help explain that, available on the Protecting Immigrant Families Illinois website. I'm not going to get into all of these different school nutrition programs. I'm going to mainly talk about the National School Lunch Program and P-EBT, but just know that there are many different programs for students who meet the eligibility requirements. And even in the summer when schools are closed, you sometimes have summer feeding sites through park districts or churches, or even certain apartment complexes will do that. So there are a lot of resources so that children do not go hungry. And I know every year the food banks, so those are the big entities that usually supply food pantries, the food banks usually do a lot of marketing around all of these programs. But if you want to know more about each of these, I've given you 2 links, both USDA as well as the Illinois State Board of Education. And you can find a lot of information about what nutrition programs are available, what the guidelines are. You can even download participating schools in Illinois. And if you are interested and need help deciphering, let me know, because I've just gotten familiar with some of the ISB spreadsheets. So what is the National School Lunch Program, right? This is really your free and reduced price meals. So whether it's breakfast or lunch or even like the after school snack and such, the key here is that families must apply with their school or their school district, kind of depends. And they can apply, you know, that might be part of enrollment in the fall and at the start of the school year. But if the family's situation changes, and certainly we saw a number of families' situations change over the last year, right? If they become income eligible later, they can apply at any time, but they must go to their school to do so. And I want us to remember that because it's really going to be relevant to the rollout of P-EBT this school year. I will also let you know there are some school districts that have community eligibility provision. We call that CEP for short. This is where, because of just the demographic makeup of their district or their school, that every child gets free lunch. Chicago Public Schools is one example. In DuPage County, we've got Addison, West Chicago, there's part of Burr Ridge, and there's Glendale Heights. There's a number of different school districts. This is all available on the ISB website, so this Illinois State Board of Education website, and you can see which schools are participating. You can download in the school lunch program to begin with, and then you can download the spreadsheet that also shows which schools in your county may be CEP. So like out in Rockford, I know there's some others that have community-wide eligibility. I can just send me an email and I'd be happy to kind of point you if you can't find it through this link on your own. But knowing that CEP provision can be important for P-EBT as well. But again, free reduced school lunches, right? So who can get that? So automatically some students should get free lunches. So if you're not in a CEP district, but you're receiving SNAP or TANF, or it's a foster child or a child in the Head Start program or a child who's been identified as homeless, they should automatically qualify for free lunch. Otherwise, if you're applying for the school district, here's the income eligibility for free or reduced price. So free lunches, it's at 130% federal poverty level, reduced school lunches at 185%, so same as WIC. National School Lunch Program also does not have an immigration status requirement, and it is not subject to public charge. So we can reassure families, you know, with mixed statuses that they are indeed eligible. We don't want children and families to go hungry if we can avoid it. So you've heard me mention P-EBT. For some, this may be brand new. For others, you may have witnessed or helped families apply last school year. So this is P-EBT, pandemic-EBT. It's a specific type of food benefit to help families buy groceries and replace the meals that students didn't get because the schools closed. It's a completely different process this school year than it was last year. Last year, families had to apply. They had to apply with DHS. There were some challenges, but we are going to just talk about now the process for this current school year, because you can't go back now and apply for last year. Also, breaking news as of last week, I think we knew this was coming, and there'll be even more information and more guidance to come, but there will be some childcare settings who will be eligible to provide or families who use certain childcare settings, not all of them, but certain ones will be able to get P-EBT there too. But stay tuned, more guidance to come. And I'm going to defer to some of our other partners for that information in the future. But in terms of how is P-EBT going to be, or first, what is P-EBT? So it is this food benefits. The max that a family will get for their eligible student per day where they don't have access to a school lunch is $6.82. So and basically it will be retroactive to the beginning of the school year. So if your school district started in August, it'll be eligible for those days that the student who is eligible didn't get a lunch because either the school was closed and doing all remote learning, or maybe they were going hybrid and so they were only there 2 days a week, and they got their lunch 2 days a week, but the other 3 days they didn't get a lunch. So in that week, they'll get benefits for just 3 days. This year, just before we get into kind of how it's going to be issued, I think it would be helpful to understand who's eligible. And there's kind of 2 levels of eligibility for P-EBT. One is the school eligible, are the people who are attending that school eligible at the school level, and then the child or the student themselves. So to get P-EBT, the family's school must be participating in the National School Lunch Program, and also have to have been closed or operating at a reduced capacity for at least 5 consecutive days at some point during this school year. So it's a pretty broad definition. And I think most schools in Illinois at some point, especially at the start of the year, might have been completely remote and meet this definition. So if it's a private school who doesn't operate the National School Lunch Program, then students at that school will not be eligible for P-EBT. The school must participate in the school lunch program. And so then when we look at students, so the child must be enrolled in the school lunch program. So they have to have already applied with their school or their school district, or be attending a school in one of those CEP districts that I mentioned, and must not have had access to an in-school lunch. So if the school is operating 5 days a week in person, or that student is attending 5 days a week in person, and there may be some districts where that is the case, the student is not going to be eligible on those days that they are at school and receiving a lunch at school. This is meant, again, to replace the lunch. And so when they're home on remote learning or an asynchronous learning day, or something like that, and they don't have access to that lunch, that's when they can get it. Also just want to remind again, because it's under the umbrella kind of National School Lunch, this program is not subject to public charge either. So I think what's important to understand, kind of 2 steps, is the child already receiving free and reduced school lunch? If yes, then we're going to talk about that first. And if not, we'll talk about that next. This year, the state is going to automatically issue P-EBT. So we want to make sure families are enrolled in the school lunch program if eligible, and that their address is up to date with the school. I know sometimes we have families who move, some move frequently. If we have some of those more mobile families, we really want to make sure that they have an up-to-date mailing address with their school, because the state is going to look at the address on file with the schools. They have an information reporting system that they submit to the State Board of Education, and it's that address that they're going to use. Cards are going to be started to be mailed out soon. Families should probably expect to start receiving them in March. If you have a family and they have 5 kids in school who are eligible, unfortunately, they're going to get 5 different cards. Each child is going to get their own card. Let's see, they're going to arrive in an unmarked envelope. I think that's just another thing you can help communicate to families. We really want to make sure that they are looking out for this in the mail. you never know if it's junk mail or not, right? If it comes in kind of an unmarked envelope. So be sure to tell families to look for that and hang on to the cards as well. Because in the future, they may reload benefits onto the same card if it continues past the school year. We really don't know yet. We have no idea. And I will summarize all of this again. So if you have a family who is eligible but not yet enrolled in the free reduced meals program at their school, tell them to connect with their school and find out how to apply. So we want to make sure they do that. They have to go to their school to apply for the free and reduced meals program. And then make sure also that their address is up to date. So contact the school if their address has changed. If they don't have an address or they don't want to use a certain address, they can use the school's address, but they're going to have to communicate with the school. And I can only imagine each school district might kind of handle some of this a little bit differently. So I think we need to be prepared that we are probably going to have to help families problem solve. So they can request that the P-EBT card get mailed to the school and then they pick it up at the school, but that they have to communicate that with the schools. The Illinois State Board of Education has been doing outreach and training to the schools, but again, I mean, I'm sorry, schools have a lot that they are dealing with right now. Trying to figure out if they can return to a regular schedule, managing remote learning, managing staff absences and illnesses, and there's just a lot. And so I'm worried that some of our neediest families, will kind of miss out on this. So we all need to kind of be reaching out to our caseloads. This is probably way more information than you need, but just to so I'm not going to spend a lot of time. This just tells you a little bit more about how, the schools are responsible for tracking the attendance. So for example, my son attends 2 days a week and then is remote 3 days a week. That's just how our district is. I could have opted to keep him home 5 days a week. But if we were eligible, the school will need to report the attendance for when he is present in the building. And then like yesterday, he was supposed to be there, or Tuesday, they were supposed to be there, but they had a snow day, but not really. They just shifted to remote learning. So like there's a lot of tracking that the schools are going to have to do, but it's based on that attendance then. And then the State Board of Education and DHS will kind of do that data matching and reporting. And that's how they will issue the benefits. So you can imagine it's going to be challenging. It may not be as timely as we like, but hopefully I am wrong. Hopefully it will all go smoothly. There are a lot of different outreach and education materials available. Some of you may have already seen that our partners at the Greater Chicago Food Depository, put out a fantastic toolkit. It's got a lot of different messages around it, including some frequently asked questions, a fact sheet, letters that can go to families. I can also let you know it's available currently in English and Spanish, but I have put in a request to get their toolkit translated as well into additional languages. So that request just went in yesterday. So hopefully by end of week, early next week, we'll have something to share. Also, the DuPage Federation, we've created some P-EBT fact sheets as well, kind of based off of their toolkit, and then another one that's completely different. So I would encourage you to access that. And then really the key messages, what I want you to take away from P-EBT, it's going to be issued automatically. So there is no application for P-EBT like there was last school year. What we need to do is make sure families who are eligible are enrolled with the free reduced price meals program within their school district. If they don't live in a community eligibility district, make sure their mailing address is up to date. Or if they want the school to receive their card, reach out to the school and then just have them pay attention to the mail, because that card will get mailed out starting in March. I think I heard that the earliest data match and possible mailing might be as early as February 25th. We also know that there's been a lot of delays with the post office deliveries. So just kind of, having people start to watch the mail for those envelopes. And this is the flow chart that we put together at the Federation, and it's available to download off of our website. And I will be emailing you a copy of this, both the color version and a grayscale version that you can print. So that'll be one of the follow-up materials from today. And then along with our frequently asked questions and our fact sheet. So lots of things to help get the word out. Okay. Quickly, I'll finish up with the other two types of food programs, and then we can take any final questions about the food assistance. So senior food programs are available in different communities. There used to be community dining sites. I guess I should have updated this because of COVID. Obviously, this is a high-risk population, so a lot of the community dining is not happening. But community dining was essentially a place where seniors could congregate for meals. But the home delivered meals program is an incredibly important program and has become even more important to make sure that seniors 60 and older who qualify can get those. Usually your area agency on aging or a senior services agency can assist. If you don't know what's available in your region, you can call the senior helpline or even go to the Department of Aging website and look up their nutrition programs. So if you have families with anyone age 60 and older who is in need of food, consider this. And then you all probably are better versed at what food pantries are available in your region. Many different types of food pantries. Some are affiliated with faith-based organizations. Others are community or social service agencies. Outside of the city of Chicago, our local townships usually have food pantries as well. But essentially they work with the larger food banks. So Greater Chicago Food Depository is one. Northern Illinois Food Bank serves the 13 county region kind of in Northern Illinois. There are other food banks throughout, like outside of the St. Louis region, the Springfield region, Peoria, like that serve multiple counties. And those food banks usually supply many of the food pantries. Most food pantries do not have requirements, don't have to be a citizen or anything like that. It's just kind of, are you in need of food? And some may ask for income eligibility. Others may just allow people to kind of attest and say that they are in need. So even people who work and have income go hungry, juggling rent, medication, health insurance, all of the various expenses. All right. Any final questions about food benefits? Okay. I am going to shift gears and we'll talk about the state cash assistance programs too. And then we'll shift gears at the end and we'll conclude with the Social Security programs. So first up is TANF, but before we get to that, let's just do a quick reminder that when it comes to immigrant status and cash assistance, have to be a qualified non-citizen. Cash has some really strict rules around it. Each program is going to have different requirements. And just also want to remind you that with the cash assistance programs, it has always been subject to public charge. So before the current rule, and probably if something happens and changes, it will probably always remain part of public charge. So we just want to make sure that we are all aware of that. So let's start with TANF. So TANF is Temporary Assistance for Needy Families. This is a cash assistance program for families who have children who are under 18. So if you're working with a family and they do not have children who are relatives in their home, TANF is not an option. It's really meant for those with children. Must be a citizen or qualified non-citizen, must have income at or below the state standards. They do not look at assets for TANF, have to be Illinois residents, obviously, to get it in Illinois. Really, to get it, you have to be a caregiver who is related to the child. You don't necessarily have to be that child's parent, but you have to be a relative of some sort, whether that's an aunt, a cousin, a grandparent, uncle, brother, sister, right? Don't even have to meet a certain age requirement. So you might have a 19-year-old sibling who is taking care of their younger siblings. Maybe their parents were detained, maybe their parents were deported, and now the 19-year-old is taking care of the younger siblings. It's not like they have to meet an age requirement to get TANF. Also, the caregiver doesn't necessarily have to be a citizen or LPR either if they're not the parent. So we'll talk a little bit about that. So you're going to see Sylvia here again. I think this might be the last time. I'm not sure. We'll might see her again. But remember, Sylvia, she is a green card holder. She meets the qualified immigrant status. She's been here for more than 5 years. Remember, she couldn't get SNAP, but she was able to get WIC. She has a daughter. She has that child living with her. She's also pregnant. So she is able to apply for TANF for herself and her daughter. Now, when she applies, the application is going to notice that her daughter's father is not in the home, or the other parent is not in the home. And so she's going to have to provide information about that, what they call the absent parent. If you've done those applications, you've seen those questions, right? As soon as you identify that there's a parent not within the home, you have to fill out what you can about that parent. Good news for Sylvia is if she's approved for TANF, she's going to get help with her daycare costs. So if she's trying to work and she's got her daughter in daycare, TANF helps with that. You're going to hear in a moment, TANF really is all about getting people back to work. It's meant to be a temporary thing while they are in need. Now, remember, she is living with her parents, but her parents are no longer legally responsible for her. She is over age 18. So even though she's living with her parents, their income will not count for her TANF eligibility. So isn't that interesting? She can't get SNAP, but she can get TANF when living with her parents. So how does TANF work? So TANF is, first of all, it's important to know it's time limited. So you can only get it for a maximum of 5 years when adults are included as part of the benefit unit. So if you have, in Sylvia's case, she was an LPR, she's qualified immigrant. If she receives TANF, and she'll have to be included in the TANF unit when she applies for herself and her daughter, she's only going to be able to get that for 5 years max. We'll talk how there are some exceptions when it's a child-only case, when we talk about caregivers who are applying for the children within their care. If eligible for TANF, they're going to be eligible for Medicaid and SNAP as well. Kind of need to revise that. I don't know why it says sometimes. Now with TANF, how it works is they do have to work with their DHS caseworker to develop a plan to get off of TANF. So I'll talk about that plan in a moment. They also have to cooperate with obtaining child support. So, when Sylvia is entering those questions about the absent parent, part of that is going to start the child support process. They also have to be seeking a job or meeting other program requirements to keep receiving TANF. There are a lot of requirements with TANF. So who has to apply together? So when there are both spouses in the home, they need to be included. If they're not married, but they have the child in common and everyone is living together, they must all be together. The child who lives with parent who receives TANF, or a grandchild if parent is included. So this kind of relates to teen parents as well. So this is just from policy who must apply together. So when you are the parent, your information must be included on the application. You don't get to necessarily opt out of it, whereas a related caregiver can. But before I get to that, let's talk a little bit more about that responsibilities and services plan. So this is really like the plan for how someone is going to be self-sufficient. How are you going to get off of TANF and be able to support yourself and your family? And essentially, a lot of it has to do with they either have to be seeking work or in a job training program or doing something. If they haven't received a high school diploma, maybe their responsibilities and services plan will be to complete a GED program. Um, when someone applies, the caseworker is supposed to help identify any barriers that the applicant or the family may have. So if someone doesn't speak English very well, it could be that they put into the plan to attend ESL classes. But if they identify that the person is ready to work, then they need to be seeking work. And if they're not working, then they have to do some sort of either they're in a training program, like I said, or engaged in some sort of community services. I mentioned child support a moment ago, and I want to talk a little bit more about that. So when there is an absent parent, the state is going to want to know if the custodial parent has filed for child support and kind of where they're at. And if they haven't, then they're going to have to, and the state will help them or will file the child support case on their behalf. DCSE, that stands for the Division of Child Support Enforcement. That is actually through the Department of Healthcare and Family Services. So when someone applies, so let's take Sylvia's example. She's going to need to not only have her interview with the TANF worker to determine overall eligibility, then she's going to have an interview with the Division of Child Support Enforcement, and she's going to have to establish paternity. So if her spouse isn't on the birth certificate, but that spouse is indeed the parent of the baby, they need to be included. She'll need to go through the whole paternity process. This can get sticky with some families, right? Especially when it's a caregiver relative who's raising their own adult child's child, right? So maybe the grandparent is raising the grandchild. That grandparent technically could have to go through child support enforcement on their own adult child. So that can be messy. We also have situations where indeed the woman does not know who the father of the baby is. It happens. They need to go through with the interview process and cooperate and do the best they can to try to help establish that if they're going to want to get TANF. So this is one reason why, to be honest, some people will say, you know what, I don't want to apply for TANF. There's too many requirements. I don't want to go after child support. The other thing that is important to know is that there is a good cause reasons not to cooperate, but you have to communicate that to the TANF DHS caseworker. So if the child was the result of rape or incest, that's how they were conceived, or there's a fear of harm, maybe domestic violence, maybe there's harm to the child or to the parent who has custody of the child. If you go after child support, need to cooperate and explain that at the time of the TANF interview. But think about this. This is trauma, and depending where people are in recovering, like, how do you explain all of these intimate, traumatizing details of your life to a DHS caseworker? Whatever we can do to help prepare the client, if they are really in need, we want to get them the support that they can need. Trying to think what else. Oh, the other thing to think about, especially with immigrant families, you could be working with a family where one parent was actually detained and or deported. And that is an option to explain that on the TANF application, that the absent parent is not present because they've been detained or deported. So you can report that as well. And then that's cooperating. They shouldn't. Yeah, I'm actually not sure what they do for child support in that case if the person's been deported. All right. Grandparents or other relatives, aunties or uncles or siblings, other relatives raising the child. So the caretaker relative can apply for the child only case, and they do not have to be included. Now, if that caretaker relative is low income as well and could use the assistance and they meet the qualified immigrant status and meet all the other requirements, then they could be included, but they don't have to be, unlike parents. Parents must be kind of considered. So you also do not need guardianship, like legal guardianship of the child. You actually just need to be able to prove that the child lives in the home with you. When you request a child only case in this situation, what that means is that the caretaker relative's income and assets do not count for the child's eligibility determination. And the real perk or benefit, especially when you're talking about young children, non-school age children, is that they can get help to pay for the daycare. So I'll show you a couple of examples in a moment. But really, the caretaker relatives, what they have to do is they have to be able to prove not only that the child lives with them in the home, but also what the relationship is. And so that can be any number of things. You know, it might be a series of birth certificates, right? Which can be challenging to gather, but there may be other legal documents that can be used to demonstrate relationship. And again, as always, have to provide that information on the absent parents. So here's one example, and I think my monthly amount down below might be a little outdated. I missed that one in updating. But we have Mildred. She's 55. She's raising her 3-year-old grandson. Both his parents are currently detained or incarcerated. Mildred's employed. You can see she's earning $5,000 a month. Mildred is over income for TANF. She would not be able to get TANF. But because she's raising her grandchild, she can actually apply for a child only case for the grandson only. And then the grandson can receive, I think it's gone up to $239 a month now in TANF, which may not seem like a lot, but you know, when kids can be expensive, right? So it could be extras clothes, it could be a school field trip if we ever get back to those. It could be any number of things. Kids grow fast, right? Those of you who have children of your own, you know how quickly you can go through shoes or snow pants. So anyway, the other real perk here for Mildred is that she can get assistance with the daycare and she wouldn't have to pay daycare for her grandson while she works because the grandson was approved for TANF. So that's a huge benefit of this program. Here's another example. We've got Claudette. Also raising her own grandchild. You can see she's employed. The difference here is that Claudette has no immigration status, but her grandson is a citizen. So Claudette actually can apply for TANF for her grandchild as well, and she can get all those same benefits. And Claudette's not a part of the child's case, so it's not, you know, it doesn't impact her. She's just the caretaker relative. She's not requesting benefits for herself. And she can get this for her grandchild. With both Claudette and Mildred, because they are not a part of the case, meaning they are not receiving the TANF themselves, what this means is they do not have any work requirements. They don't have to do this responsibilities and services plan. It's a child only case. The other thing is then there's no 5-year time limit for that child either. So it's an interesting thing about the TANF program. It's just an interesting way that it's set up. That's about all I was going to say about TANF because honestly, it's one of the few benefit programs that still gives me trouble to this day. It's just very complex. It's so complex, they still assign TANF DHS caseworkers. You know, they have a TANF caseload. There are work requirements, there's other program requirements. But I do want to mention there are some special rules, especially if you work with minor parents. There's a lot of different special rules about if they're still living with their own parents and can they get set up as a separate case or not. So if you work with that population, just send me an email and I will be happy to explain more or send you the policy reference. Also with survivors of domestic violence, you know, there are some special rules around that too. Real quickly, I'll just give you an example. So if you are a survivor of domestic violence and you are already receiving TANF in your household, that means you have a child at home. But sometimes the survivor needs to flee and unfortunately sometimes leaves the children, or the children are no longer with them. Maybe they have the children go stay with another relative and they go somewhere else. There are some special rules to allow that person to continue to receive their TANF benefit. And then the chart on the right here is the maximum payment levels for TANF right now. So I apologize, my two slides with Claudette and Mildred were just slightly outdated. I still had last year's figures. So you can see they didn't go up a whole lot, but the child only cases, one child will receive $239. Apologies, I don't have the household size here, but the first line is a household of one, household of two, then three, then four. You might be wondering, how can an adult and child be a household of one? And that is a pregnant woman. A pregnant woman who doesn't have any other children can actually get set up and approved for TANF. And in that case, since she's an adult receiving it, she would receive a max of $319. So I'd like to point this out because sometimes TANF, as a cash assistance program, there is a lot of stigma around it. But please tell me, family of four, when adults are getting the benefit too, the maximum they can receive is $655. Please tell me how they can pay rent and meet all their other needs on $655, because I don't see how they can, especially in the greater Chicagoland region. But really, housing costs. I mean, affordable housing is one of the biggest challenges in the United States. So anyway, just a little bit there to show you. Any questions about TANF? I will say we do see a lot of immigrants who, even if they have children who are eligible, they're very fearful of applying for TANF. Part of that is, yes, it is indeed subject to public charge. And even though the children's use of benefits should not count against a parent, the reality is that if they're going to be approved for TANF, the reality is they are so low income that when we talk about public charge and the totality of circumstances, that could be a negative factor. And in fact, even historically, my understanding is the way they always looked at TANF and public charge was it the family's sole means of support? It's one thing if someone's working and still eligible for TANF because they're so low income, but if they are not working and they're solely relying on the TANF, that could have been a negative factor before as well. And so, all we can do is educate and let that immigrant family make their own decision around this program. I'm going to talk briefly about AABD cash and then even more briefly about refugee assistance. But AABD cash, this is also known as the state supplemental payment program. And so it's available to seniors or persons with disabilities who have needs that exceed kind of their income by at least $1. So what this means is there's a formula that the state uses to determine how much someone can get. I am not going to attempt to do that formula, but I will give you kind of the overall how it works. So here we have Marvin. He's living alone. He is receiving SSI. So he's already getting cash assistance, but through the Social Security program because he is disabled. In 2021, the max he can receive is $794 a month. On his application, he reports what his rent and utilities are. Maybe he's getting some housing assistance, right? And so that's why he's paying $650 a month. He has what they call the Obama phone, but has been around since before then. I think is it Lifeline or the telephone assistance program. And he also has some other expenses. And so the state will look at all of this and determine that, well, okay, here's what your income is, here's what your expenses are. You actually still need X amount of dollars to get by. And they can approve the supplement then of AABD cash. Now, he's not going to get the maximum benefit amount in AABD cash because he is receiving SSI already. So he might get a small amount. Maybe it'll be like $35 or $50 a month, kind of depending how they work out their budgeting. But still, that's an extra $30 or $50 that he didn't have before. Other people do receive the max, and I apologize, it's escaping me and I just don't have it in front of me what the maximum amount is. It just went up. So I can certainly, if you are interested in seeing what's the maximum, I will say it's not as much as SSI, which actually isn't much. Sorry, I'm hearing something in my house. I apologize. I'm going to continue, and then I think we might take a quick break so I can check. So anyway, persons age 65 and older either are already receiving SSI or not eligible for SSI. There's some other requirements as well. Oh, thank you. Yes, I am going to take that break. So hang on, I have an 8-year-old, so I'm just going to go check real quick. So if you need a stretch break, this should honestly only take 2 minutes. I just need to make sure everything's okay. So bear with me and I will be right back. Sorry about that. Thank you. Everything, I don't know. Let's just hope there's not pipes issues. My son is fine, and I thought I heard something in the basement, and I will just check that out later. So apologies. Okay, so where were we? We were at who's eligible. So age 65 and older. So must meet all of these requirements. And so I think the main thing for immigrants in particular is that there's two sets of rules. One, if they were here on or before 1996, they might be able to get this program, and if they were denied SSI in particular. And the other thing is that if they were receiving SSI and then their SSI ended because of a 7-year time limit. So let me talk a little bit more about that after I talk about the next slide, which you'll see is very similar. So this was our aged population, right, for AABD cash. And then for the younger persons under age 65, this really is referring to our people with disabilities. And so same thing, they're either receiving SSI or they're not able to get SSI because of income rules. Or again, non-citizen whose SSI ended because of a federal 7-year time limit. And this is the next slide. So what is this SSI and 7-year time limit, you may ask? So essentially, especially for like refugees or asylees or other qualified non-citizens, they're eligible for SSI. And it's really a factor what we see with our refugee and asylee population, not so much lawful permanent residents, right? But with these folks. And what it means is that immigration gives them a chance to kind of get settled and go through the process, get their green card, through and become a citizen, go through the naturalization process. But sometimes that takes a long time, right? There are fees. It takes a long time to get your green card sometimes. And sometimes it takes a long time to go through naturalization and have the resources to meet those requirements. And so what will happen is SSI will end after 7 years if they have not yet become a citizen. So as long as they are still working towards becoming a citizen and their SSI ends, the state will approve those individuals for AABD cash. And so you can see here, I've actually listed refugee, which qualified statuses we're talking about. And we're really talking about those humanitarian special immigration statuses listed here. So let's look at an example. We've got Ahmed, he is 65, or he was 65 when he came to the United States. He got SSI right away, he's a refugee, and he just got his letter from Social Security, and he and his family come to you because they don't know what to do. As long as he is working towards citizenship, he can apply for the AABD Cash Assistance Program. And that's kind of all I'm going to say about AABD cash. It's again for seniors or persons with disabilities who don't have access to some of the other resources like SSI, or they need that extra supplement. And then refugee cash assistance. I don't have a lot to say about that program either. It's a refugee resettlement program. So really, again, to help people get settled, get acclimated in the United States, and really just some extra monthly cash assistance. But it's only available for their first 8 months. So when refugees are resettled in the United States and they apply for this program, they're only going to receive it for 8 months. Or if it's an asylee, it's from the date asylum was granted. This used to be really critical with Medicaid for the first several months of someone's residency, especially those adults without dependent children. That has changed because of Medicaid expansion. So most people can get either Medicaid or ACA. So with Luis, he's 19, he just arrived. It says admitted as an asylee. I probably should have said approved for asylum status in February 2021. That's a better way of saying that. Luis can apply and he can get refugee cash if he meets the income requirements until October. If he doesn't realize that this is available to him and his 8 months have passed, he can't get it then. So it's just for those first several months. Cash applications, same way, apply via ABE, complete the interview. Trying to think what else. It's pretty straightforward. This interview, though, is a little different than the SNAP. It will look at the same things like the expenses, right? What they pay, what their income is, what kind of support they're getting, and all of that. But then there's some extra things, with AABD, they might be looking at disability status. They might be needing additional documentation if they're working towards citizenship or not as an immigrant. For TANF, they need those proof of relationship and proof of children living in the home. All of those are important things to submit. Some people may wonder about the proof children live in home. What can be used to verify that? It could be, if they rent an apartment, it could be a lease. It could be medical records, school enrollment records. It could even be a neighbor or someone else, a faith-based leader. So I suppose even a social service agency could there's a form to fill out to say basically that, yes, I know this family, and yes, I know that this child lives at this address. It's more of an issue with those caretaker relatives who don't necessarily have guardianship. Again, you don't need guardianship. Okay, link card again, revisiting this just briefly because I talked about link in terms of SNAP, right? That's how SNAP benefits are delivered. Well, it's the same card for the cash assistance through the state. So just keep that in mind. Activated the same way as we discussed earlier, but it's cash. And so whereas SNAP benefits can only be used for food, this is cash assistance. It's like an ATM card, essentially. But let's talk about that because there are fees associated with it. So please, please, please don't have people using the ATM to check the balance of their TANF account because they'll start getting charged I think they get to check it once or twice. After that, there's a fee charged for it. Also, if they're using it at ATMs outside of Illinois, there could be additional surcharges. And we're talking about a limited amount of money on that link card anyway. So there are ways to check the balance by calling the number, and we can avoid some of those fees. And just a couple of things, because sometimes, people don't understand, or, maybe culturally things are done differently in different communities. And so we just want to remind them that there are some pretty strict rules with the link card. So it might seem like common sense to some of us, but just to remind people, it is illegal to sell the card or to let other people use it. Whether it's cash or SNAP benefits, really. And that can result in the loss of benefits. In fact, if they report their card lost or stolen more than, oh goodness, is it 3 or 4 times? I can't remember. They actually will get notified that they could, next time they report a lost card within a certain time frame, that they might be investigated for fraud. So we want to make sure they know what they're doing. It's also against the law to access cash benefits or withdrawal from, like, at a casino or a liquor store or adult entertainment clubs. And this might also seem like common sense, but what if that's where they work? What if they work at a casino or an adult entertainment club? Maybe it's just they're not even thinking and they use the ATM there. Or unfortunately, in some communities, that the closest ATM may be at the corner store. So we just want to be mindful and let them know to be careful about where they're withdrawing their cash, just to protect them and their benefits. And then the last thing I want to talk about with state of Illinois benefits is the importance of reporting changes, and especially for SNAP and TANF. Because if they do not report that the number of people in their home has changed, or their income has changed, and their SNAP or cash assistance should have changed as well, they could end up in an overpayment situation. And we really don't want that to happen, because then they'll owe that money back. So just to be really timely with reporting any changes. I think policy says they're supposed to report changes in income or the number of people in the home within 10 days, I believe, is what it says. So how do we report changes? Well, if they can use Manage My Case, that's one way, and then they have the record and the proof that they've reported the change. There is also a page on the DHS website that has some information where you can report changes. And also just trying to connect with that local office, which I know is not easy right now. So, but these are all the ways that they can do that. Apparently I have a typo. Okay. So I also wanted to talk briefly about the Child Care Assistance Program. I am by no means an expert with this program, but I think it's a valuable resource, especially if people are able to return to work. So basically, this is a way to get assistance for those high costs of daycare. And there are copays, so depending on the family's income, they may have to contribute. They also have to use a child care provider that is willing to accept the state's reimbursement rate and kind of copay structure. Not all child care centers will do that, but it's worth asking. Now, when applying for child care assistance, they will ask for the child's immigration status, but please know there is no requirement and there is no public charge concern either, but they do ask that question. To get child care assistance, you have to be an Illinois resident and working and meet the income thresholds for the program and any of these number of things. So it is a pretty straightforward process. Now, if there's one parent at home and the other is working, you're not going to be able to get child care assistance if there's a stay-at-home parent, because that is technically, it's their their job, it's their role to care for the child. I realize sometimes culturally, that there might be some gender, I don't want to stereotype, but sometimes, right, there are different gender roles or expectations, depending. And so we just need to be mindful that you won't be able to get it if you have one parent who's still at home. Here's an example. So really, it's not so much that the family has an immigration status, it's the childcare provider who must have an authorized status. So in this case, we have Susan. She's undocumented. She has 2 children. Her neighbor babysits or watches the children. I shouldn't say babysit. The neighbor is the caretaker while Susan works. And the neighbor does have a social security number that does allow her or him to work. And so if the neighbor is willing to accept the state's reimbursement, Susan could apply and get help. There's a difference between licensed and non-licensed daycare providers, as well as home-based versus center-based childcare settings. And so if you're interested in more, there's a whole policy chapter about the qualified providers. There will need to be a background check done. And it could even be that it's not even her neighbor. It could be that the grandparent who doesn't live with them, the grandparent is the one watching, or maybe Susan's sister or someone else is watching the child or the children. So how do you find a child care center? How do you get help with this application? Each county, each region has different child care resource and referral agencies. For example, out in DuPage County, it's our YWCA of Metropolitan Chicago. That is our child care resource and referral agency. I know that's the same in Lake County as well, but there's many others who can help. And so this is one resource to find. And you can apply online or apply on paper. And I have not heard recently, but there had been some challenges with online applications. So it's really recommended that if you do submit an online application, to then call that child care resource referral agency and make sure they know that you did submit the application. So that's all I'm going to say about that program, just because I'm less familiar with it. Let's see. I'm going to just check for questions. Thanks again for understanding. So I think there's let's see. So I see a lot of questions. If new senior patients eligible for SNAP or Medicaid only, from Oksana. I think you're talking about the new health benefits for immigrant seniors. And we will talk about that more next week, but yes, it's just Medicaid. So that population is not eligible for SNAP or cash assistance unless they have a qualifying immigration status. And they probably don't if they're getting the new health benefits for immigrant seniors program. Another question, has the state stopped sanctions during this current pandemic? Plus, if mom has provided information on missing father, why does the state make them provide it over and over again? That is a great question, and I don't know about the process with that. I have heard similar things about the requesting the same information. I don't know if it just means that it didn't get connected to the case somehow. I'm not sure. And honestly, the sanctions, I don't remember seeing anything. I would suspect yes, but I don't want to misspeak. So I'm going to make a note of that question and look it up. And in my follow-up email, I will answer it. I know they've really been trying to keep people protected, and they've even extended cash cases like they did the SNAP cases, just not as you just don't see those policies as frequently, is what I'm trying to say. So Migdalia is sharing, she has a family where the SNAP benefits were canceled because of the daughter working, but when mentioned to the DHS caseworker that the daughter moved out, can she reapply? Caseworker told her yes, but that she needs to prove the daughter moved out by showing address. Is this true? Yeah, that would be like a change in household. So it would be a change that needed to be reported. I think the timing, I think we could try to make an argument that if she's reapplying after a certain period, but I suppose they have the right to request that if that daughter had been linked to that case before. And now it might be that maybe I don't know if the daughter's income is at a point where they could apply too, but that would be another consideration. Okay, looks like that is it. So, oh, wait, one more just came in. Okay, got it. All righty. So shifting gears completely to the Social Security Cash Benefits Program. Please keep in mind this could be its own like 3-hour training, and we're not going to do that. But I find these programs so fascinating and interesting and full of trivia. So, but this is kind of our last section, so we're doing really great on time. So Social Security Administration, these are federal cash benefits, two types, and they're completely different. One is the Social Security insurance programs. Sometimes these are referred to as Title II benefits. That's just Title II of the Social Security Act. We don't need to really know that, but you will see that language sometimes. I want you to think of it as insurance. You have to have an insured status, meaning you have to have had a work history. What does that mean? So we'll talk about that too. But there are really three kind of ways people can access these benefits. And it's when they retire, when they become disabled, or if the person with the work history dies. And the survivors then, the surviving dependents or widow or widower can receive, the surviving spouse. Then there's supplemental security income, also known as SSI. Very similar to AABD cash. So I will talk about both, but let's start with the insurance programs. So if you're getting paid and you see on your pay stub the FICA tax contributions, it's going to this pot of money. So when we work, we are earning work credits that are paying into the Social Security and Medicare system. So first we have to have that. We have to have sufficient earnings to be able to access these programs. And then depending, we have to meet a certain age if we want to retire and draw our Social Security retirement. There are specific criteria for surviving spouses or children of the deceased wage earner. And then for disability, there are different criteria to meet. We have to be a citizen or a qualified non-citizen with authorized work in the United States. So that's what this slide is really talking about. So immigration status and the Social Security insurance programs, you have to have earned those work credits through a valid work authorization. So if I'm working and I'm undocumented and I'm using someone else's Social Security to work, guess what? I'm paying into the system and I am never going to be able to draw that. And that's what my fun fact is. This is where I have to educate my own extended family sometimes. So the reality is we would be in trouble with our Social Security insurance programs if we did not have undocumented immigrants contributing. They contribute over 13 billion with a B into the Social Security system, and they're not eligible for the benefits. Yeah, and I could go on and on, but I will just stop there. So I think it's really important to understand that we have many, many people paying into the system who cannot access it because it wasn't their number. They also file taxes in other ways as well to contribute. Okay. Also though, DACA, our Deferred Action for Childhood Arrivals, they may be eligible for retirement or disability insurance because if they have been authorized to work, they have a lawful, a Social Security number for work purposes, and they are lawfully contributing to the system. So they may be eligible for that. I mean, we haven't really seen this population age and reach retirement yet. And who knows, fingers crossed that, you know, I mean, there was a bill, my goodness, what was it, sponsored by Durbin and Lindsey Graham to, you know, get our dreamers finally a pathway. So maybe this will be a moot point in the future. But yeah, as long as they're kind of in that lawful status, have that valid work permit, they are contributing. They may also qualify, and you'll hear what this means, as a dependent of someone who's already drawing. So whether it's survivors benefits or what's called auxiliary, and we'll talk about each of those in a moment. So how do we earn these work credits, right? So on average, we have to have at least 40 work credits or 10 years of work history to be eligible for these programs. There are some exceptions for younger people who become disabled, like if it's a 21-year-old or if you're under age 24, you actually only need 6 work credits to access the disability insurance program. But that's another point. We earn a maximum of 4 work credits per year by paying into our Social Security taxes, and it's really a dollar amount. It's to get that 4 work credits. It's not like it has to be in each calendar quarter of the year. So as soon as we earn 5,880 a year, we have earned our maximum 4 credits per year. So here's an example. We've got Avon, who's working as a landscaper. He just works during those lovely months that I can't wait for right now. During this time, he earns $40,000 a year. So he earns all of his salary with just April through October. He has been paying his FICA taxes, so he gets his 4 work credits. Another quick fun fact about Social Security, when we talk about our taxable earnings, just so you know, Social Security tax, it's only taxed up to $142,800 in a year. Now I know that's not us, right? If we're working in this field, we're not earning this money. But when you think about people, you know, especially in private corporations and such, and if they're earning, you know, $250,000 a year in their salary, they're only paying FICA taxes on up to $142,800. So when we talk about needing to sustain Social Security, because we have a lot of people turning retirement age, the baby boomer generation in the United States, you know, there's a lot of concern about the amount of money. The way Social Security has always worked is it's always the future generations, like those of us who are still working now, that our contributions are going to fund the current retirees. We have something like 10,000 people a day turning 65 and starting to draw Social Security as they reach their full retirement age. So yeah, we don't have enough workers to support the baby boomers. This is why we need the immigrant population. Okay, age eligibility for retirement. So here's your mini crash course in retirement. So you can retire with Social Security as early as age 62, but know that it will be a reduced benefit, and that's a lifetime reduced benefit. It's not like when you turn your full retirement age that then you get your full benefit. If you retire early, it's reduced. Your full retirement age is dependent on when you were born. So anyone born, I think it's 1960 or after, your full retirement age is 67 years old. Before that, it's different. My mom was born in January of 1956, so she just turned 65. She just got her Medicare, but she is not going to reach full retirement age until next April. I believe it's age 66 and 4 months is her full retirement age. And then if you delay retirement and you keep working up to age 70, actually you can get your benefit check to increase. And I get into this more in some of my other training, but just thought I'd give you that background, because financial planning isn't something people think about all of the time. And some people think as soon as I get to 62, I'm going to retire. Well, here's a great example of how that could work out. So we've got Omar, 62. He's told if he reaches full retirement age, he'll get $2,056 a month in his retirement insurance. But he isn't working right now. He needs income. So if he wants to file for retirement now, look at that reduction. It's about a $500 reduction per month. And that'll be what he gets then. But if he is still working and he wants to wait to retire until age 70, it'll increase up to $2,797 a month. And people are working longer. So we'll see what Omar decides, right? But that's just an example of how the age you retire does vary on how much you get. Survivor's benefits is when someone with that work history dies and they have surviving spouses or dependent children who meet these criteria. So for the spouse to get the survivor's benefits, they either have to be caring for children under 16, or they themselves are age 60 or older, or they're 50 and disabled and they don't have their own wage history to draw SSDI. And same thing, they're not able to get their own retirement. For children, they have to be unmarried and either 18 or through age 19 while in high school, or have a disability that has been a condition since before age 22. So that's like the overall kind of criteria for survivors in general. For immigrant survivors, they have to have been the surviving spouse or child meeting those criteria, and the wage earner who has passed away had a social security number that allowed work. And then those surviving spouses or children must also be in the United States lawfully. It can be permanent or temporary. They can have lawful presence, but they have to be here legally to receive those survivors' benefits. If after that wage earner dies, the spouse wants to relocate back to maybe their country of origin, and they're not a citizen of the United States, whether or not they can continue to receive that depends. And so I'll talk about living outside of the United States in a little bit. It really comes down to, do we have treaty with the country they're returning to, and some other factors as well. These are just some examples, again, of who could get survivor's benefits. So we've got Kima. She's 52, so she's over age 50, and she's been recently diagnosed with a disability of MS. She is a lawful permanent resident, but she's only worked 2 years. Maybe she has only been here a couple of years. But her husband passed away, and he had been the one who was supporting her, and they had no children. Because she is disabled and because she has a lawful status, she could get survivor's benefits. She's not going to get SSI. You'll hear about that in a moment. And she's not eligible for her own Social Security disability insurance because she's only worked 2 years paying into Social Security. But because her husband passed away, that's why she could get survivor's benefits as long as he had the work history and a lawful work history. And then we've got Cedric, who's a citizen, and he's received SSI since age 18 because he was born with a disability. You meet Cedric and you find out that his father has passed away. And this is a really, I should have probably taken this out. This is a really unique rule for children who've been disabled since before age 22, disabled adult children. This is where, because his father has passed, he can actually have his benefits convert, and he's no longer going to get SSI, but instead he'll get survivor's benefits. So it's kind of a really special program. So let's talk a little bit about disability insurance. So to get Social Security disability insurance, you have to have the sufficient work history and a recent work history. And so it's kind of known as the 20-40 rule. So, you need to have at least 40 work credits, right? 10 years of work history to access any of these programs. But with the disability insurance, they want to see that you had a recent work history. So at least 20 credits in the 5 years prior, I think, to the disabling condition. And I apologize, I meant to delete this. I'm not getting into the disability determination process in this training. It's really a separate training. I can tell you in short that you have to have a diagnosis, a disabling condition. It can be a physical or mental impairment that prevents you from working, and it is expected to last at least 12 months or longer. So it's really the definition of disability for adults is all about the ability to work. You can find more information on the Social Security website. The listings of impairment talks about all the different medical criteria needed to prove that the person has a disabling condition. Now, how much you get, you'll get, if approved, what you would get at full retirement age, even if you're younger than retirement age, right? So D'Angelo's 50, he becomes disabled. He's told if he reached full retirement age, he'd get $2,000 a month. He's disabled though now here at age 50, he can get that full amount. And then what happens at his full retirement age, if his disability has not improved, they'll convert and he won't really notice any change, but it changes from disability to retirement. He won't see a change in his amount. It'll probably go up each year a little bit. It's called COLA. It's the cost of living kind of increase. And then auxiliary benefits, very similar to survivor's benefits in terms of the criteria to get it, except in this case, the wage earner hasn't died. Instead, the wage earner, the person with the work history, starts drawing their own retirement or their own disability insurance. And that's when certain spouses and children could get the benefits. So the criteria is very similar to survivors. And same thing, to receive those auxiliary benefits, the spouse or children must either be citizens themselves or have that lawful presence. They actually also have to meet a 5-year residency requirement. I didn't mention that. And there are some special rules for like surviving family members of veterans or military members, some other special immigration statuses too. I said I would mention this living outside the US and then retirement survivors or disability insurance. So if you're not a citizen and you live outside the US and you work eligible and receiving these benefits, your benefits might stop. So the takeaway is if someone is going to be living outside of the country, and I believe it's even, it's the 6-month rule. If it's going to be 6 months or longer, they should really check with Social Security. There's actually a screening where you can see whether or not you can continue to receive benefits. It's not an easy answer. It's kind of like whether or not we have reciprocal treaties with other nations who have similar kind of retirement or similar programs to our Social Security. And they also have a publication specific to this very issue. So if you're interested in learning more, I'd encourage you to find that. I will say the Social Security website is one of the more user-friendly pages. I can usually find easy to understand information by looking. So, but I've given you some direct links here. So before I go into SSI, let me just check to see if there's any insurance questions real quick. And I'm just going to read it. So 67-year-old patient being denied Medicare because wife on SSDI at 61 has Medicare herself. 67-year-old keeps being denied because he himself doesn't have enough working credits. Ooh, complex case, Oksana. Just reading still. Filed jointly during time she worked. So have they tried? I think I would have to I might have to do some research on this because there's actually a lot going on. Because I'm wondering if it's something about the wife's age with the Medicare eligibility. But by virtue of the wife getting SSDI, they should at a minimum be allowed to get some auxiliary benefits. And then I just need to double check the Medicare eligibility because this is kind of a reverse situation from what we're used to. I will say Social Security, you're right, most local offices are closed or all working remotely, but you can try to call either a local office or the 800 number. And if you haven't seen like their communication, I'm wondering if they have a My Social Security account. So I'm going to take this one offline. This is a great example that I might have to start including in my disability navigation training, or my Medicare training too. So thank you for that. The meeting chat will save, so I'll be able to pull that up and kind of look at those 2 questions that I haven't been able to answer so far. All right, I'm going to shift gears now to SSI, and I really want us to think of it as something separate, right? But people confuse SSI and SSDI all of the time because it is for persons with disabilities, but also persons who are aged or blind. And essentially, SSI is considered when someone doesn't have the sufficient work history to get the insurance programs, or maybe they don't have a recent work history for SSDI, and they're very low income and very low asset or low resources. So for SSI, age 65 and older, blind or disabled, the maximum you can receive in 2021 as a single person is $794 a month. So when someone says they have disability and they have SSI, but they're getting $1,400 a month, yeah, that's probably SSDI, not SSI. Resources or assets are limited to a single person, $2,000. And there are certain things they don't count, like they won't count the home someone lives in, one car, and some other things. Now, with immigrants, what we need to be concerned with SSI is it's not enough just to have a qualified immigration status like an LPR for 5 years. And I'm really talking about LPRs here. They also have to have the work history. And you can combine work credits. So it could be you and your spouse's work history as well. DACA, just so you know, currently DACA are not eligible for SSI. I do not like the word welfare, but some people think of SSI as a welfare program. So it's much stricter eligibility rules. So while DACA are earning and paying into the Social Security insurance system, they are still not eligible for SSI. We've already talked about how refugees or asylees can receive SSI while they are working towards citizenship. And then once they become a citizen, they can continue to receive SSI. You cannot receive SSI outside of the United States. You must live within the US. Even if our country has a reciprocal treaty for the Social Security insurance programs, it does not apply to SSI. And public charge has always applied to SSI, the before rule and the current rule. So these are just some 2 examples. We've got George, he served in the Army, he was an LPR since 2010. So he's been here 11 years and served in the Army. And so he was recently diagnosed with end-stage cancer. So it could be that he doesn't have a work history for SSDI, but because he served in the Army, he kind of has a special status that will allow him to get SSI. And then we have Hassan, who is 10 and born with disabilities. He has refugee status. His parents had the sufficient work history. And so he could get that because his parents had the work history. With SSI, please know for children, so yes, Hassan as a child could receive SSI, but his parents' income will count. And so there are times where children are denied SSI because their parents' income exceeds the limits for the program. And then what we would say is at age 18, it'll be really important for him to reapply. And then he'll be considered his own adult case. Often a question, should they apply for one or the other or both? And they can certainly apply for both. It can be a good idea, but they will, Social Security will look, and if they're over the income limits for SSI or they don't meet the immigration criteria, they won't proceed with the SSI determination. There's really 2 parts to these applications for disability in particular for both SSDI and SSI. There's first all the non-medical stuff. So do they meet all the financial and work kind of income requirements? And then also the medical criteria. When it comes to language access, Social Security's website does have information in multiple languages. So that's a positive. They are also supposed to provide interpreter services as a government agency. So this slide just outlines those requirements. Yeah, I think the takeaway is I'm not quite sure how they request the language. If they don't speak English or Spanish, they're supposed to just stay on the line. And then when they answer, somehow be prepared to explain Urdu interpreter or German interpreter or whatever language it might be. You can file claims for all the Social Security programs on the website or by calling this 800 number. You can do a lot of things on the Social Security website. You can estimate, all sorts of what you might need. And if approved, things need to be now, they're not mailing retirement or disability checks. They are direct deposited into a bank account. And if the person does not bank, then they're going to receive a direct express debit card. And that's how their monthly benefits will be distributed to them. So there's no more paper checks coming for Social Security. It's also important to report changes to Social Security. I think I left that example with Cedric in there in particular, especially for disabled adult children. It is important to report when their parents pass because they may be able to access benefits. Same things if the parents retire. But marriages are important. And when I do my full Social Security training, we get into all sorts of fun things about former marriages and different things. But I will say Social Security historically has always made sure that their beneficiaries receive the maximum benefit that they are entitled to, especially with the insurance programs. It could be your work history, it could be a spouse's work history, it could be a combination of both. You can also set up your own My Social Security account webpage, or account, and access it through the Social Security webpage. You can do a lot of things there. You can even help your clients set one up. It's got to be their account though. You can request a new Social Security account. You can pull up your benefit letter. You can see what your full retirement age is, and if you reach it, what your full benefit amount is as of today. You can see your own earnings history. There's a lot you can do with the My Social Security account. All right, so that's really the highlights again of the programs. I do a much deeper navigating disability training. I don't have one scheduled right now, but just keep an eye on things, and you will be added to our mailing list unless you don't want to for future training announcements. We're kind of going to try to revamp how we market things over the next few months, and we will continue to offer virtual training, I'm sure, into the future. Let me see. Okay, so Nina, when you ask, will it be different for survivors' benefits when to claim? I'm not sure I understand the question, so if you could just add a little bit more to that question. Yeah, go ahead.
I know someone who husband worked here and died. I think it's probably last year, just March or sometime, due to cancer. And he was like IT guy, but the wife has been here like I think more than 6 years, and they have children about 6 years old, and she, of course, she doesn't have much English and social thing, and doesn't know the American system. So for her, from today's workshop, I learned that she can be beneficial, as a survivor, but like how to help her to claim. Is it, if she claim, can she claim now? Is it will be different if she delay it, or
no,
she can?
she should be able to, as long as her children are still under age 16. She herself could receive, and her children can receive until they turn 18 or 19. And then again, as long as she has one of those lawful statuses. So what she needs to do is contact Social Security. Usually, I guess it kind of depends. Usually like funeral homes are usually the ones reporting the death, but if she has a death certificate or needs to get one from like a vital records department at the county or the Department of Public Health, she could do that to show, and then she can file that claim. I do not know if they will go back retroactive. I just don't know. That's actually a question I don't know the answer to and just thought of. But yeah, she should contact Social Security. She might even be able to try to file that claim online, but she'll need to prove the death and the relationship.
Okay. Another question is, in the future, if she's able to work a little bit, will that affect any of the claim for the survivor's benefit?
Yeah, not for the children, but it could for her.
Mm-hmm.
And I don't know that
And
off
if
the
it's
top of my head.
married, of course, that
Yeah,
affects. Yeah.
for survivors, I don't know that off the top of my head. I would have to double check. So, yes, but yeah.
And it doesn't matter, when the husband's age, if he has reached the
It's just,
benefits.
yeah, it
retirement.
really, so that's a good point. It really does depend too. Did the husband have, that 10 years of work history? Did he have the
10
40
years
work
history
credits?
depends on if he has 10 years working
Yeah,
history. Okay.
yeah. So he'll need to have had
I
the
guess
40
he
work
has. Yeah.
credits. Yeah. And
Mm-hmm.
then, yeah, and so she should be able to. But there's
All
a lot
right.
of information. There's even, I think, a publication about survivors benefits on the Social Security website. So I don't know if that's in how many other languages that is in. I don't know that they have everything translated, but maybe you can help her kind of look through that information.
Yeah.
I will say
Yeah.
that the challenge is, we don't have a lot of assistance sometimes with these kind of claims and applications. So it can be challenging, even with
Yeah. Yeah.
disability.
It's
It should,
challenging because the Social Security office is not open.
right.
Also, she lives in downtown. We live in suburban, but maybe I'll find some other agency to help her.
Yeah.
And of course, for coding, translation, I don't think we are allowed to do three-way
Okay.
coding, right, or something. I'm
Yeah.
not very sure. Yeah.
Another option might be if there's and I don't know if they are able, if they have the capacity, but sometimes there's some legal aid agencies
Legal
like
aid.
Legal Aid Chicago. And I know there's others that are just not coming to mind right now. So sometimes there might be, I don't know with survivors. We usually see it more with disability applications, and even then it's usually not enough resources to go around. So
Yeah,
yeah,
I
she
think
can try.
maybe she has someone to help regarding if they are 20 years old, the car can be, change the title to her name or something like that. I'm not sure if they know anything, to help her in terms of the applying for social.
Yeah, well,
Those
with survivors
benefits.
benefits, yeah, with survivors benefits, the assets and all of that are not a factor. The survivors
Okay.
benefits off of the husband's work history is really what they're looking at there.
Okay.
Yeah. So
Thank you so much.
you're welcome. Let me go through these final few slides with the resources, and then I can open it up to more questions because we have just a few more minutes. And you can access these on your own too, and some of you may be very familiar. So here are just a few of the Social Security resources that I thought would be helpful when it came to immigrants and Social Security. So just giving you the direct links to that. Back to the state benefits with SNAP, and I forgot to mention earlier, there is a special email set up for P-EBT. So these are just some general email addresses that you can try if you need help. I really don't know the ths.covid19. I've never tried emailing that. It's supposedly set up for general questions about public benefits for Department of Human Services, but I don't know, all of these emails that they set up for us are dependent on someone checking them and managing and responding them. And sometimes they're great, and sometimes we have to give reminders and follow up. I will say, I mean, they've always had unprecedented volume coming through, but I mean, I think they've had a lot of challenges that they've worked through. So it's still just challenging to communicate is the biggest problem, but I do know that it's easier than it used to be. And I know that Secretary Grace Ho is very customer focused, and she is also very immigrant friendly. So, you know, it's a huge system. I've also given you the website that DHS has with the information about the link card. And then just some partner organizations, and I've mentioned these before, but it's worth mentioning again. So Help Hub is for providers. You can ask questions of many experts about all things related to benefits. If you haven't, please check out the Protecting Immigrant Families Illinois website. Lots of fact sheets there, especially focused on the immigrant population. Same with our partners at ICER. Some of you may be very familiar with ICER, maybe a funded partner, may work for ICER, but so much information on their website, including the Know Your Rights information, which I think sometimes can be really important and has been over these last several years. And then I am putting on the Greater Chicago Food Depository website just because they have a lot of different information on there. They have a P-EBT, frequently asked questions section. They have a section about the WIC program. Also, they do convene a monthly SNAP advocates call. So if that is something, if you do a lot of SNAP applications, if you're a funded partner to do SNAP applications and want to get connected to that call, let me know and I can connect you with the folks who manage that listserv. And there is a call tomorrow at 10 a.m. So I'm sure we'll get an update about P-EBT for childcare and all of the other things. I mean, they've been the way we get a lot of information about all those different waiver programs for SNAP over the last year due to the pandemic and many other things. So for food resources, it's or food advocacy, I should say, they convene it, and it is a statewide call. So we have folks from Metro East down by East St. Louis, folks from Springfield, and much more. It can be just even a helpful listserv to get connected to. Okay. And so here's my contact information. I have my phone number here, but honestly, the email is best. I'm still working from home primarily until my son can get back to school full time. So we can hope it's coming, right? I don't know. It's already February. Check out our website, especially the resources tab. We have a lot of different information there. And with that, I thank you for attending, and I can open it up for any final questions that you might have. I will email the presentation and the recording and an evaluation and other materials. Most of that should come tomorrow, including I'm going to look up the answers to those 2 outstanding questions. So thank you, and thanks for bearing with me. I know it's hard to sit and listen a long time. I will see if there's a way I can break us up into breakout rooms with the medical content and the medical information next week, but if not, hopefully this was still helpful, and I really appreciate your participation.
I have a question,
Yeah.
Nina, again. I didn't get any email regarding to the last week's
You didn't.
video.
Okay. So
I
that's
think that, yeah.
okay. My apologies, Nina. So let me follow up with you. I thought are there any other individuals? Because I had another person email me privately. I thought I pulled our email list from the list of participants. Rather than the registrations, I pulled it from the list of participants from the webinar, but maybe that didn't capture your email for some reason. So I will send you a separate follow-up email. So sorry about that. Oh, all right. And maybe I should just send it to everyone who registered but wasn't able to attend. So very good. All right, everybody. Well, thank you so much. And I will probably see many of you, quote unquote, next Thursday for the medical assistance. And we'll talk mainly about Medicaid, but I am going to touch briefly on Medicare, ACA, and some resources, especially for undocumented. And there's not a lot, but we will just run through those options quick. So thank you. Thank you. Have a good rest of the evening and stay warm. Bye-bye.